Hi, my name is Kelsey Eck. I'm a licensed marriage and family therapist and the manager of our clinical training program here at Family and Children's Services, a division of Caminar. You might hear me refer to our agency as FCS or Caminar throughout this video because that name gets a little bit long. Every year, Caminar, or FCS, looks for 4 to 6 students who are ready to begin their clinical training hours and are on track for either the MFT, LPCC, or MSW. Caminar is a nonprofit organization providing mental health services to the community. We are contracted with the county, which means that we provide primarily services to those who have Medi-Cal. However, we are always looking to expand and hope that in the near future we're going to be able to provide mental health services to those that wish to pay privately or may have other insurance providers. We have a comprehensive clinical training program in which we work diligently to provide you with experience and training to not only help you develop into a well-rounded clinician, but to also be able to provide accurate and effective diagnosis, case management, assessment, treatment planning services, and therapy services, while all abiding by accurate and appropriate law and ethics. Our mission is to support you in becoming your best clinician self. Students who are enrolled in our clinical training program can expect to work approximately 20 hours per week and hold a caseload of about 8 to 10 clients. However, this is very much going to depend on your needs as a student and a clinician. We provide weekly individual and group supervision to ensure that you feel supported and that you and we are in compliance with the BBS to help you accrue those 3,000 hours towards your licensure. We provide extensive Medi-Cal training to help you feel really confident in being that therapist while also billing Medi-Cal, which can be really challenging at times. So we're going to support you in learning how to effectively and accurately assess, diagnose, develop an initial mental health assessment, collaboratively develop a treatment plan with your clients, and provide accurate and effective therapy, case management, and collateral services. As I mentioned before, we also want you to have a really well-rounded experience here, so we're going to work with you to balance your caseload between having children, teens, families, adults, and older adults. Part of that well-rounded experience is going to be working with a really diverse population, which also includes working with a wide variety of mental health issues. This could include mental health issues such as trauma, anxiety, depression, substance abuse, and other more acute and severe mental health issues such as obsessive compulsive disorder and schizophrenia. As I mentioned before, we want you to feel really supported and confident as a clinician at our agency. That means that we're going to provide weekly and monthly trainings. Some of those trainings will be within our agency and some of those will be outside of our agency, such as with the county. Some of the topics that will be included in these trainings are theories, intervention, diagnosis, and treatment. All of these trainings are at no cost to you. Our clinical training program is also at no cost to you. We actually work to provide you with a stipend if it's in the budget for the year. Because we are a nonprofit, our budget relies on grants, fundraising, and contracts with the county. So we can't guarantee it, but we do our best. Our clinical training program begins in September and ends in August. Okay, we've got 4 different locations. We've got 2 downtown in San Jose, 1 in San Jose off of the Alameda and Julian Street, and then 1 up in Palo Alto. However, your main office as an intern or trainee with us is going to be at the San Jose office off of the Alameda and Julian Street. All right, what are the requirements of you? What do you got to bring to us? You got to be enrolled in an accredited university on track for licensure either on the MFT, LPCC, or MSW track. Another requirement of you is that you have a really strong passion and interest for providing mental health services in the community mental health setting. As I mentioned before, you're going to be billing Medi-Cal and you're going to have some clients with really high needs. So it's really important to want this work. It's also going to be important that you have strong written and verbal communication skills because of all of that documentation. It's also going to be really important for you to want to be on our team. FCS is a very team-oriented agency. We really believe in working together and learning from each other. So we want you to be a part of our team and we want you to want to be a part of our team. So you're super excited about what I had to say, you're passionate, you've got the interest. How do you apply? You're going to email me your resume and cover letter by March 5th to my email at keck@fcservices.org. That email address is going to be in this video and it's also going to be on our website. Please email me those resumes and cover letters by March 5th because in the month of March I'm going to be reaching out to potential candidates to schedule interviews. Because of COVID-19 and the shelter in place, most likely all of those interviews are going to be conducted on some type of online platform. Thanks for listening. If you got this far, I'm excited to potentially meet you and maybe have you come on board to our rock star of a team. Stay safe.